Hi everyone, thank you so much for coming. We've set up this Q&A in light of the COVID-19 pandemic because and I'm sure lots of others on the panel have received hundreds of emails on all sorts of different issues. So we thought that this would be a good opportunity for people to ask those questions. We've got Cllr David Mellen, the leader of Nottingham City Council, with us. We have Amanda Sullivan, the Accountability Officer for Nottingham CCG, that's the Clinical Commissioning Group.
Hi.
We have Jules Sebelin, the Deputy CEO of Nottingham CVS, that's the Community and Voluntary Service. And we've got Rob Johnston, the Policy and Campaigns Officer for Midlands TUC, the Trades Union Congress.
Hey. But I guess our real message is to all of the people that want to help is to try to do it through already established organizations where they have policies, procedures, they'll be able to look after you, where you can help neighbors and people that you know. Absolutely do that. We're all for that. But what we want to do is make sure people stay safe, they stay informed.
Is a big ask now for ministers. We need stronger, clearer guidance on which workplaces should and should not be open. There have been too many horror stories coming in on a daily basis, and this is an urgent ask of the government to tighten up this guidance, show some leadership, and make it absolutely crystal clear what is not and what is an essential workplace, and then employers to step up to the mark, work with their workers to put the appropriate measures in place. But what we're kind of asking, we want bosses to do is suspend biometric clocking in systems and the use of shared tools, provide workers with access to washing facilities as already required by law, but introduce strict cleaning regimes and make available a proper PPE. That is coming through daily, that isn't the case. To consult with health and safety reps and committees. They're meant to do required by law already, but now more than ever, it's those health and safety reps know their place inside out or will ensure things are as safe as they can be. Give workers free parking so we can avoid public transport and take the strain off. And provide changing facilities to give workers the option to change clothes before attending work and going home. Real practical things that can be put in place for those workplaces that are still open.
Do follow the advice about social distancing. Do look after yourselves, look after each other. If you do have any queries about your healthcare and you're not getting what you need from the people such as your doctors or nurses, do drop us an email on or go onto our website, which is notccg.nhs.uk, and we'll do our best to answer any queries or resolve any issues that you have. What I would advise, if you think you have got symptoms of COVID-19, then ring the 111 service and they can help you work through, or go online and it does a symptom checker for you.
What is the council doing to help homeless people?
Yes, the government have given us additional responsibility to help homeless people, and particularly they're giving us some money to help get people who are sleeping on the streets off the streets and into accommodation. And we've been able to identify, I think it's 60 beds in hotels in Nottingham where people will be looked after and given food and given a bed. But that demand on those places is great, and there are other groups of people. I believe there's people who have no recourse to public funds, people who might be asylum seekers in that system, who also are needing accommodation.
We've got a question here from Greg Howard. Hi, Greg. Food couriers are not supported by the Chancellor's Self-Employment Income Support Scheme. They've been misclassified and have little or no PPE. What can be done to help these workers, and how can we campaign against the companies they work for? This is an excellent question. I know that this is impacting many of my constituents who are delivery riders or Uber Eats riders. Gig economy workers are just not protected at all by the Chancellor's measures. Of course, they can't claim statutory sick pay because they're not classed as employees. And then there's the matter of statutory sick pay itself not being enough to live on. I've written to the Chancellor about this, and the Labour Party front bench has been raising it continuously, the need for food couriers and all gig economy workers to be given statutory sick pay, and for that rate of statutory sick pay to be increased so that it's enough to live on. On the issue of PPE, I completely agree that food couriers are frontline workers, they're key workers, and as such they should be given full PPE. Again, this goes back to the need, in my opinion, for a universal basic income so that all workers, all people can have their basic needs met during this crisis. We're getting lots of questions in about provision of PPE and COVID testing for NHS workers.
Yes, thank you. So on the PPE, I know that is a big issue across the whole country, and the supply of it has increased really massively over the last couple of weeks, but unfortunately so has the demand for it with the current situation. So we are in Nottingham and Nottinghamshire, we're able to access some from, if you like, national stockpiles, and some of that is on an ordering basis that our health workers, we help health workers to order where that's needed. Some of it just automatically is now being delivered. You may have seen on the news the sort of army doing the deliveries out to the hospitals. So we're doing our best to make sure that the limited supplies that there are go to the places that need them. And as I say, the organisations are really working well together to do that mutual aid. So my understanding is more and more supplies are coming online very rapidly over the next few weeks. So that will help ease the situation, I think.
We've been asked by Arch about cancer patients and non-urgent treatments and what Nottinghamshire's position is regarding cancer treatments. Amanda, would you like to answer this?
Yes, yes, of course. So we absolutely see the need for cancer treatments to carry on, because they're obviously time critical treatments. What's happened, what the government have done actually is they've, if you like, block purchased all of the private hospital capacity up and down the country. And that's a good way of protecting additional hospital beds. And so what we're looking at in Nottingham is thinking about all of the hospital beds that are available. It may be that some people might find that if you're having certain types of cancer treatment, you might be asked to go to a different hospital, but we are definitely prioritising it. And the clinicians who are in charge of the cancer services are all working together. So your services shouldn't suffer. I think people might find that some of the, if you like, routine care and treatments that aren't particularly critical for time, some of the, if you like, the more very routine things, you will have to wait a bit longer for those. But for cancer treatments, we will continue to provide that.
I'd echo all of those sentiments. Thank you to everyone who's joined the call. Thank you particularly to all of our panellists and for all the work that you're doing to get Nottingham through this really difficult time. I'm sorry to the many people whose questions haven't been answered. We only had an hour, but if you found this helpful, please do drop us a message and we'll look at organising similar events, perhaps on specific topics in future. From my perspective, my office is still open as usual as people are working from home, and I'm continuing to do surgeries every fortnight via telephone. So please, as always, contact us if you have problems and we'll do everything we can to sort them out. Thanks, everyone.